The development and distribution of COVID vaccines occurred under unique legal frameworks that provided pharmaceutical companies with significant liability protections. At the center of these protections is the Public Readiness and Emergency Preparedness Act, which was invoked in early 2020. The PrEP Act's provisions shield vaccine manufacturers from legal liability for injuries or adverse events related to COVID-19 vaccines, except in cases of willful misconduct. This protection extends to companies including Pfizer, Moderna, and Johnson & Johnson, covering both the development and administration of their vaccines. Under this framework, instead of pursuing traditional lawsuits, individuals who experience serious adverse effects from COVID-19 vaccines must seek compensation through the Countermeasures Injury Compensation Program. This government-established program provides a specialized pathway for claims related to pandemic countermeasures, including vaccines. These protections were deemed necessary to encourage rapid vaccine development during a public health emergency. Without such shields, pharmaceutical companies argued they might have been reluctant to accelerate vaccine development and production. Given the compressed timeline and unprecedented scale of the vaccination campaign, the liability protection framework includes several key elements: complete immunity from lawsuits related to vaccine injuries, protection for manufacturers, distributors, and healthcare providers administering vaccines, a compensation fund for serious adverse events, streamlined regulatory processes for emergency authorization. However, these protections have sparked debate. Advocates argue they were essential for rapid pandemic response, while critics contend they limit accountability and potentially compromise patient rights. The program's compensation process has also faced scrutiny over its approval rates and compensation levels. Understanding these legal frameworks remains relevant as they continue to influence vaccine development and emergency response planning for future public health crises. It's worth noting these protections differ from those covering routine vaccinations, which fall under the National Vaccine Injury Compensation Program, a separate system with different procedures and standards. Readers interested in learning more about vaccine injury compensation programs can visit the Health Resources and Services Administration website for detailed information about both the CICP and BICP programs.